Dear students, I wish to welcome you to today's lesson. We are going to learn how to initiate the IV therapy, which is a short-term therapy that is commonly used in the hospital setting. I wish to show you the supplies and the equipment that we are going to use as we perform this procedure. We have our trolley here. On top is a sterile field. We have the surgical gloves, they are sterile. We also have the cannula. We have this kidney dish with the swabs and the gauze. The antiseptic solution is already added. We also have the given set and the tourniquet. Everything that you see on this cloth is sterile. We have the stripping is already cut. Here it is. So underneath we have the antiseptic solution and also a pair of scissors that we use to cut that stripping. And we have the 3-bin system, non-biological waste, biological waste, and the sharps. We have a trip stent, which is above the patient, 1 meter above the patient, and the infusion solution. We have our patient here. This is Mrs. Lerado. Our patient is unconscious and she cannot respond to calls, to touch, to anything. But I'll be talking to her, I'll be communicating with my patient. So at this particular moment, I'm going to start the procedure. Good morning, Mrs. Lerado. My name is Sebawati Sapane. I'm your nurse for today. According to the doctor's prescription, I have to insert the IV line with a normal saline that is running through. I wish to ask if you will allow me to continue with the procedure. Thank you so much. Before I could go and wash my hands surgically, I wish to position your hand properly. But anyway, I hope you are still comfortable. You're still okay. And so I'm going to expose only your hand. I'm not going to expose the whole body, but just your hand to have access to your hand. Okay, so I can see that this is the vein that I am going to use. So I wish to palpate it. All right. I think this vein is perfect for use. All right, now that I have done this, I'll go and wash my hands. Okay. Then I'm back washing my hands. I will wear my gloves. Hand wash. I will already put my surgical gloves. I'm discarding it. And I am going to put this given set. This is the given set, the tubing. I remove this cap, discard it. This is the chamber, and we have the control clamp. I move it closer to the chamber, and then I close this and I straighten this tubing. Alright. Okay. So I'm going to insert it inside this tubing. Squeeze and make sure that it is half filled. Then I have to make sure that this tubing forms a U shape. Then I release this clamp, open it slowly. As you can see, the drops are coming down, and here the fluid is pushing down the air that is inside this tube. It has to go until there are no bubbles, until there is no air in this tubing. There we are. The air is coming out. Okay, right. So we need to check if there are any bubbles in this tubing. There are no bubbles so far. Okay, right. So I'm going to keep it here for a while. Okay, Mrs. Lerat, I'm going to apply this tourniquet on your hand, a little bit up on your arm. Okay. So you can put it here. So I'm going to puncture this vein about 15 centimeters away from where I have applied the tourniquet. So before I do that, I need to cleanse this area. Within a swab in a circular motion just once, and then this is the biological waste to just discard, and then we have this. Mrs. Narat, I'm going to puncture your vein. So I anchor the vein with this thumb of the non-dominant hand. So this needle, its bevel should be facing upwards, and then I insert it at an angle of 30 degrees. All right, so remember, okay, nice. You insert it until you see the blood coming inside this chamber, then you know that this is inside. Then you pull this chamber backwards, and then you push the needle up. And then when we have done this, I'm going to release the tourniquet, and then I'm going to connect the little adapter. So I remove this cap from here, and then press here a little bit. Okay, let us see if we are inside the vein. We need to see the drops coming down, flowing. So you see it is flowing there, and then when we look at the punctured side, there is no swelling, and no tenderness as felt. That means it is correctly inside the patient's vein. So since we have this drops of blood, I will just wipe it off. I want to leave my patient clean and comfortable. So it's biological waste. At this particular juncture, I'm going to secure this, but before that, I'm going to apply a dressing here. So this is the dressing that I will apply to support this vein. Okay. We need to form a loop like this. Okay, we are almost done. Right, then I take the last one and put it here. Then lastly, I will apply a label on top of this that indicates the time of insertion, the size of the cannula, and the date. So I will have to remove this. This soiled linen saver, and together with this, because we are done using it. So I'll have to discard it. Then Mrs. Lerato, I'm done inserting this IV line. It is running well at the required number of drops. So I wish to thank you so much